Hi, my name is Monique Delva, and today I will be informing you on fibrocystic breast changes, formerly known as fibrocystic breast disease. About a year ago, I was conducting a self-examination of my breast when I noticed a few lumps that caused me to seek medical attention. After running a few tests, I was diagnosed with fibrocystic breast changes. Now, men and women alike, to some degree, are knowledgeable on breast cancer because of the high awareness there is in our society. Unfortunately, most women do not conduct self-examinations of their breast the way they should unless there is a concern for breast cancer. There is no known history of breast cancer within my family, but because my family comes from a third world country where healthcare is minimal, I always promise myself to stay on top of my health because I honestly do not know what my medical history is. When I noticed these lumps, my first thought was obviously cancer. After the tests were ran and the doctors told me it was nothing more than fibrocystic breast or dense breast, I took it upon myself to get more information on this. Fibrosis is scar-like tissue formations in the breast, and cysts are fluid-filled sacs. Doctors at the Mayo Clinic refer to this tissue as glandular, as they normally form around the glands or milk ducts in a woman's breasts. Fibrocystic breast changes fluctuates with a woman's hormonal changes, as the symptoms are worsened right before menstruation or either after. These changes tend to make themselves prevalent during a woman's childbearing age. Now we'll discuss how fibrocystic breast changes can hide breast cancer. Doctors have not found any correlation of breast cancer and fibrocystic breast change, meaning fibrocystic breast change does not increase your risk of cancer, although it may cause cancer to go undetected. On a mammogram, fatty tissue in a breast appears black, while fibrocystic breasts or dense breasts appear white. What also appears white in a mammogram is cancer and tumors. So when a woman with just fatty tissue goes and gets a mammogram and there's a white spot noted, then the flags for cancer and tumors are raised. While a woman with fibrocystic breasts or dense breasts who may go and because their breast is already fibrocystic and dense, when there is notice of white spots, the thought of cancer doesn't arise. So there might be cancer there that just because it looks like the rest of the breast, it may go undetected. Now, some symptoms that you would want to look for to assure yourself that you might not have cancer, although regardless of any changes that you have, you should seek medical attention, is puckering of a certain area of your breast, thickness of a certain area of your breast, on the skin on the outside, and any bloody discharge that may be coming from your breast without any squeezing. Those should raise your cancer flags. While the symptoms with fibrocystic breast are tenderness, soreness, pain, and of course the lumps. And there may be non-bloody discharge coming from your nipples. Now, if you're like me and don't know your family medical history, any concern that you may have is enough to send you to the doctor. Now, as I stated before, the risk for cancer is not increased because you have fibrocystic breasts, but because cancer can be well hidden within fibrocystic breasts because of the way they appear on mammograms, you should pay attention to your body. The American Cancer Society, suggests that women understand these changes. Fibrocystic breast changes are common, but there are certain changes within a woman's body that is uncommon. So only you really know what feels right within your body and when you should seek medical attention. When you do seek medical attention, be sure to keep a list of all the medication that you are on, any family history that you may know of, and the length of time that you have been dealing with these changes. The medication can help the doctors understand if you're just experiencing a side effect. Your family history, of course, can help the doctor understand whether you need to be referred to a breast specialist. And the length of time also helps the doctor determine exactly what they may be dealing with. I hope today's discussion has helped you understand what some women may refer to as a common problem that is not always just that common. I hope this will also help you pay attention more to when you do a self-exam, or when a doctor examines you, or when you go get a mammogram done, so you can kind of understand a bit more as to what the technician is looking at. And I hope this will help you pay a little bit more attention to your health as a whole, not just your breasts, but your entire body. Only you know the changes that go on within you and at what point. Thank you.